What was the full economic extent of our response to COVID-19 from policymakers? What can we expect going forward in the next pandemic if it were to occur again on a global scale? This is the theme of our discussion with Dr. Bhattacharya. He is a PhD economics graduate from Stanford University and also holds an MD from Stanford. He is currently a professor of medicine at Stanford, where he directs the Stanford Center on the Demography of Health and Aging. His research focuses on health and economics and the well-being of vulnerable populations and epidemiology. Dr. Bhattacharya, it's a pleasure to have you on the show. Welcome.
Thank you. Pleasure to be here.
We're going to be talking about your work regarding research on the effects of COVID-19 policies, and in particular, the Great Barrington Declaration, which is something that you've co-authored with a number of your colleagues, addressing these effects and what this means for the economy going forward. But first, let's talk about a trending topic that people are concerned about: monkeypox. It's popped up on the news. And it's been circulating in headlines. Now, as of this morning, I read on CNN, 257 confirmed cases have been found around the world. I know that's not a very big number, 257 in a global population of, close to 8 billion. But again, remember that COVID started from 1 as well. So at this point in this outbreak, if you want to call it that, is this root for concern?
So a few things about monkeypox. First, it's not a new virus. It has popped up over and over again. I think in the United States, as recently as November of 2021, there was a case of it. 2003, there was a small outbreak in the United States like animals carry it. So monkeys, obviously, but also I think people think rats and other rodents carry it. So it has animal reservoirs. The most important thing people should understand, though, it doesn't spread the same way COVID does. Right? COVID seems to spread by aerosol. It spreads very easily from person to person, and it's very hard to stop that spread of it. Whereas monkeypox seems to require more physical, like close physical contact, especially with people with symptoms of it, which include the pustules and the pox. It's a pox virus, and so you might produce skin lesions that help spread the disease. So because it doesn't spread the same way, I'm not nearly as worried about monkeypox spreading the same way as COVID. I suspect this virus this little mini epidemic will die out as fairly quickly. It's not nearly the same thing. The other thing about it is we already have a vaccine that's actually quite good against it. Even if you have if you have it and you're vulnerable, you might get it. So I think this is a very different situation than COVID.
Okay. Now, Doctor, you mentioned that this is a virus that's not entirely new. There have been studies done on this already. How much research has been done on this monkeypox virus up until now? Because you recall in the early days of the COVID-19 spread, the WHO actually initially said that it's not human-to-human transmissible, a message which they later rescinded. So perhaps there's evolution to be made in terms of research. Perhaps there's more that we don't understand, or is this something that we've already done a lot of work on and have the ropes down in terms of how it works?
I mean, I think it entered human circulation in 1958. I mean, it was first discovered in 1958, and the 70s or 80s. I forget exactly when it first entered human circulation. For the most part, it was a virus that was found in Africa, and it involved animal to human transmission. Although there were documented cases of human to human transmission, almost always involving very close contact between people, close physical contact between people. So I think a lot more is known about this virus than was known about COVID in early 2020.
Okay.
So yeah, I think, and I said we have a vaccine that actually can treat it even after you've gotten the virus. It can help alleviate the symptoms of it. We have a lot more information about how to manage this virus than we did about COVID in early 2020.
So you're not concerned about another nationwide or internationally coordinated lockdown or series of lockdowns in response to monkeypox?
Yeah, I don't think that is in the works. I mean, things could change. There are, it is a little bit of a bigger outbreak than we've had before. Although like I said, in 2003 there was a fairly large outbreak in the United States.
Right.
I mean, like 100 cases, something like that. It's this is in the class of things that we're used to dealing with in public health, in public health infectious disease epidemiology. This is not something like COVID-19 where you can see like the last 2 and some years have been completely marred by the COVID response.
Dr. Bhattacharya, I'm suspecting that not all outbreaks around the world are reported by the media. I suspect that there are some under your research or under the purview of other epidemiologists like yourselves who that escape the attention of the media. So generally speaking, how many outbreaks we're looking at per year that really don't make it to headlines?
I mean, most of these infectious disease outbreaks don't make it to the headlines. They're small. And the techniques of controlling them don't involve society-wide alterations in behavior and panic. I think COVID is unique in that the response to it required enormous sacrifices on the part of healthy people in huge, basically every corner of the earth. This infectious disease is it's just normal in human societies. It's not like we, I think in the West we thought that for a long time that we conquered all infectious diseases. That's not true. Infectious disease is an ever-present threat. But it's not an ever-present threat that necessarily requires us to change every single part of our lives in order to avoid it. We have vaccines. When these outbreaks start to occur, we have techniques that don't require altering all of society to be concerned about it. I think the reason why this monkeypox outbreak is getting so much attention now is because we've been primed to worry more about infectious diseases than we had by the last two and some years of COVID. I think this is the kind of thing that would have been a little story here and there, and then it would have died away very quickly in the pre-COVID era.
Okay, let's study then the effects of economic policy, government policy on the last pandemic that we had, COVID-19. And throughout our discussion, we can talk about what to do or what governments should do in response to another pandemic, which many influential people like Bill Gates say is just around the corner. It will happen again at some point. It is inevitable we will get something like COVID-19 at some point in the future. You are the co-author of the Great Barrington Declaration. I'm just going to read a section from the website to give a primer on what this is. It says, coming from both the left and right and around the world, we have devoted our careers to protecting people. Current lockdown policies are producing devastating effects on short and long-term public health. The results, to name a few, include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health, leading into greater excess mortality in years to come, with the working class and younger members of society carrying the heaviest burden. Keeping students out of school is a grave injustice. Doctor, tell us about the work that this declaration aims to achieve, or the outcomes that it aims to achieve, and how you became involved in this line of research.
Sure. So the Great Barrington Declaration is a very short document. Your listeners can go look at it online. It basically we wrote it in me, Sunetra Gupta of Oxford University, and Martin Kulldorff, then of Harvard University, wrote it in October of 2020 in response to the policy that we were seeing put in place for the control of COVID-19. And those policies, I don't really, again, need to tell viewers about this so much because they've lived through it, involved a whole suite of absolutely extraordinary changes and alterations in everyday life, including things like closing schools, shutting businesses, generally putting in the world at large this idea that we must fear one another, as vectors of viruses, rather than and trying to reduce connections between people, social distancing and whatnot.
Okay, you've listed a number of side effects, if you want to call them side effects, of these policies. I'm just going to revisit these bullet points again and we'll drill into them in deeper detail. You said the results, to name a few, include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health. Okay, so that's very broad topics there. We can go on for hours, but just in your opinion, doctor, name some of the most profound detrimental impacts of these COVID-19 policies from government that you think are the longest lasting.
Yeah, so I think probably the single worst was school closures. What school closures did was shut out worldwide something like 1 billion kids out of school for 2 years, replacing it with inadequate substitutes like online schools. It's poor kids that have paid the highest cost of this. There was research from before the pandemic showing that even short interruptions in schooling of children can result in long-term ripple outcomes in their lives. Kids who don't go to school who skip substantial parts of school actually end up leading shorter, less healthy, poorer lives. So we'll see that ripple effect, especially around the world, but certainly in the United States, especially among poor families for forever, for a very long time, I think. Mm-hmm. The economic effects of the lockdown policies that we followed, especially on poor countries, have been particularly devastating. So some estimates suggest that 100 million people were thrown into poverty, dire poverty, less than $2 a day of income or less worldwide. And tens of millions of people were pushed into dire food insecurity, meaning that they don't know where their next meal is going to come from. In March of 2021, the UN estimated that 230,000 children had died in South Asia from malnutrition alone and from skipped vaccinations. The effect of the poor, the economic, by the economic dislocation caused by the lockdown policy followers are just devastating. And I mean, it's something that we're going to be coping with for a very long time to come.
I want to come back to this, but just to circle back on the keywords that you said earlier, you called online schools inadequate. I mean, we have online work. Universities are done online now. Why do you think schooling done on an elementary or perhaps middle school level done online is inadequate?
Well, I mean, if you look at the estimates that are coming out of the education literature now, the learning loss is devastating. You can ask, how do you teach a 5-year-old to read or a 6-year-old to read through Zoom? It requires physical presence. A lot of times the kids, especially poor kids, were not supervised adequately because parents had to go to work. And so you end up with a situation where you've replaced what would normally be a difficult challenge in itself, educating children, with in person, with interactions between kids and with other teachers, with a setting where like a lot of students disconnected. Right. So if you look at the reports out of the education literature, kids would turn off the videos and go do other things. They just didn't connect with the curriculum and with their teachers in the same way they would have in person schooling. I think if the literature also suggests that people who substituted tutors, enrichment programs, generally more well-off kids suffered less, but poor kids that didn't have access to these sorts of benefits have suffered greatly from this. And you can see it in the test scores, math, reading, so on in the United States. That there's an enormous learning loss, especially in places where the school disruptions lasted the longest.
I know education isn't the focus of our conversation, but I'm just curious, at what age does it become, I guess, more relevant for people to start learning online? Under that age, it becomes essential to have physical closeness for education.
I mean, I think online learning can be an adjunct to learning, but at any age. I teach in a college, in a university, and I can tell you that the students, we've done our best, I think, to try to adjust and provide a good product for students, but it's not the same. And students have felt the harm from that. There's no age, I think, that online learning is a full substitute for actual in-person instruction as a general matter. And I think especially for younger kids, it's especially bad. Kids need physical interaction with good, caring teachers in order to learn effectively, I think.
Does the same principle apply to working conditions? I know that people are opening up their offices either on a full-time or part-time basis, and there's talk from even traditional financial banks, financial institutions, that full-time work at the office is now a relic of the past. It's never going to happen. What are your thoughts on working remotely and its effects on productivity?
So there was a study done in the early days of the pandemic that looked at work in the United States and estimated that only about 30% of jobs could be really replaced with work from home using Zoom and other technologies. That means 70% of jobs can't really be adequately replaced. Most work requires, again, physical presence. There are a class of folks who can do those jobs that don't necessarily require. I think it's like I said, about 30%. And some of those jobs, I think, are much less productive, even though it's possible to do it remotely. It's much less productive to do it remotely than in physical. Now, but there are some small subset of the jobs that can be replaced adequately with work from home. Might even be better, because then you can have a broader, more dispersed workforce sitting all across the country. But I think that is a small subset of the jobs in the United States that can do that. And if you look more broadly to the poorer parts of the world, it's an even smaller subset of jobs that can replace that way. Okay. There are industries where the transformation will be positive. Absolutely, that is absolutely true. So for instance, we're doing this interview remotely. I've done a lot of interviews remotely during the pandemic. The news media then can now conduct these kinds of interviews that otherwise would have been much more costly and difficult to do. Like I think some software engineering jobs might be doable online, where it's better. But I think as a whole, I don't view most jobs in the United States and elsewhere being replaced by by online activities.
I know we got sidetracked. I'm going to come back to the Great Barrington Declaration, but just one more question on remote work, because it ties into your work on mental health. Now, Zoom stock's down 60%, so I think the markets might disagree with the notion that this is here forever to stay. But that aside, you mentioned that productivity might still be lower, or the effectiveness of work might still be reduced if it was done remotely. Is that because of physical infrastructure that needs to be done in place or on site? Or is that because of the physical closeness of people that should, I guess, according to some research, increase productivity and enhance mental well-being? What is it? Is it basically a hardware issue, or is it a people issue?
I don't think it's a hardware issue. It's primarily a people issue. I mean, but of course, it varies from job to job. I'll say, like, what I found in my own work,
I'm not talking about a mechanic who needs to be physically there. I'm talking about like office workers,
Yeah, like so I do office work. I'm a full-time researcher, right, and a teacher. I'll tell you, I really miss the serendipitous interactions with people here on campus, other faculty members, many of whom still have not come back to campus, and it's really difficult to like quantify that. But it's like, you have new ideas that come out of chance conversations that can happen just by normally if you're physically present in the same place, that don't happen if it requires a Zoom meeting. Okay. So I think I can imagine there are jobs and settings that allow those kinds of things to happen even by Zoom, but it's harder, I believe, generally. And so I think there may be some jobs that can be replaced and be more productive, but I think that's a small minority of all the jobs. Most jobs require some sort of physical presence.
All right. Interesting discussion that I'd like to continue with you at another time in greater detail. Let's come back to COVID policies now. We'll touch on a few responses to the Great Barrington Declaration and some misconceptions that maybe people have from the other side of the debate. This email came in from Francis Collins, sent to Dr. Anthony Fauci. I'm just going to read the email here, sent on the 8th of October, 2020, and it was the email was obtained through Freedom of Information request, I believe, and it says, "Hi, Tony and Cliff. See this website leaking to the Great Barrington Declaration. This proposal from 3 fringe epidemiologists who met with the secretary seems to be getting a lot of attention, and even a co-signature from Nobel Prize winner Mike Levitt at Stanford. There needs to be a quick and devastating published takedown of its premises. I don't see anything like that online yet. Is it underway? Signed, Francis." Okay, so a lot to unpack there. Dr. Francis Collins, then director of the National Institute of Health, and Dr. Fauci, the director of the National Institute of Allergy and Infectious Diseases. We all know him. These two had an exchange. First of all, why do you think that email took place? And second, was there actually a successful takedown of the Great Barrington Declaration from the government following this exchange?
Yeah, so the Great Barrington Declaration, what we called for, because the lockdowns were so harmful, and actually there was no good evidence that was stopping, capable of stopping the disease from spreading. The Great Barrington Declaration called for focused protection of the old. There's a 1,000-fold difference in the risk of severe disease. Older people, I think, is 80% of the deaths have been people over 65 worldwide. 40% of deaths in the United States have been in a nursing home setting. So we call for focused protection of the older populations while at the same time lifting the lockdowns. We wrote this on October 4th, 2020. And October 8th, that email from Francis Collins you just read went to Tony Fauci asking for this devastating takedown. It's very interesting that only 4 days after we wrote this, with this declaration, which went viral, like almost a million people signed it, tens of thousands of scientists signed it, including doctors signed it. It posed a deep challenge to the strategy that Tony Fauci and Francis Collins had pushed on the United States, this lockdown-focused strategy. They essentially were saying to the president and others that if you want to control the virus, you have to lock down. You have to do social distancing, closing restaurants, closing schools, closing businesses. Essentially, this sort of physical separation as a way to stop the virus from spreading. The Great Barrington Declaration, in effect, was a challenge to that policy by people with credentials that they couldn't just ignore. They wanted to create an illusion of consensus, scientific consensus, around the lockdown policies that they were pushing that didn't actually exist. And that's why Francis Collins wrote that email to Tony Fauci, because he wanted to use the media to take down, in his own words, this alternate strategy, because it was so sensible to so many people, and it worked. Unfortunately, it worked. Like, he engaged the media to smear me and the co-authors of the Great Barrington Declaration. Many people who signed the Great Barrington Declaration lost their jobs, lost grant opportunities. It was essentially like a full court press to demonize people who were arguing that no, the science does not require a lockdown.
Well, okay. First of all, how do you respond to the claim by Dr. Fauci that you are indeed fringe? I guess that's not really so much a claim, but sort of just a categorization, if you want to call it, use politically correct terminology. The categorization that you are a fringe epidemiologist. Respond to that, please. So I've been publishing epidemiological work in peer-reviewed journals for 20 years, including on infectious disease. I sat on PhD dissertations for epidemiology students at Stanford. I taught a class in epidemiological methods and statistical methods for 20 years at Stanford in the medical school. Martin Kulldorff, who signed the Great Barrington Declaration, or co-authored the Great Barrington Declaration, he designed the statistical structure used to track vaccine safety by the FDA and the CDC. Sunetra Gupta at Oxford University. Her job title is Professor of Theoretical Epidemiology. So it really wasn't. That word "fringe" was designed to create this idea that there were these crazy people at places like Harvard, Stanford, and Oxford that were off the reservation and spouting nonsense. They had to say something like that, because otherwise, what you have is a very prominent group of scientists, and again, I'll just include the three of us, tens of thousands of doctors from all around the world signed this. Doctors and epidemiologists and scientists signed it from places like Harvard, Yale, you name the prominent university, you find someone that signed it. So it was a challenge to them. They had to essentially use that word "fringe" in order to create this sense that they were
the possessors of souls, the sole possessors of scientific knowledge. You could see in how Tony Fauci reacted to Rand Paul when he was challenged in the Senate around this. Tony Fauci said, "Look, when you attack lockdowns, when you attack me, you are not simply attacking a man; you are attacking science itself." They needed to have this idea in the public at large that they knew what they were doing and that there were no reasonable challenge. And the existence of the Great Barrington Declaration essentially said to the world, look, there is a reasonable challenge. There is not a scientific consensus in favor of the policies that we follow. And that's why that word fringe was used. It's a name calling rather than a debate with the ideas.
Like I use the term categorization to be politically correct, but yes, name calling, whatever you want to call it. Jay, have you done cost benefit analysis on the effects of lockdowns? Yes, you've listed the detriments of lockdowns on mental health and the other things that you talked about, but what if we never had lockdowns? Do those costs outweigh the benefits?
Yeah, so I actually don't know that there's a ton of benefits from lockdown. The literature, there's two sort of strands in this literature. One strand uses modeling, which essentially says, okay, if I keep people apart, disease won't spread. But that's an assumption. That's not real world. When you look at places that didn't lock down, places like Sweden, or didn't lock down very sharply, or places like Florida, you actually look at it. It turns out that they didn't do any worse than places that did lock down in terms of the age-adjusted mortality from COVID, the overall excess death rate. So for instance, if you compare Florida and California, the age-adjusted death rate from COVID is very similar from Florida and California. Lockdown. Florida didn't lock down. California locked down. So it's Sweden did better than most countries, certainly better than the United States, despite not putting in place school closures and a whole host of other lockdown-related policies. So I don't really think that there's strong evidence that the lockdowns accomplished much in the way of long-term benefit in terms of protecting people from COVID. And the harms are really hard to deny, right? All of the harms we discussed earlier, reductions in cancer screening, reductions like people skipping routine vaccinations, mass poverty worldwide, and I think that the schooling harms, all of those, and many more that we'll find out over time. There's no question the lockdowns did not really benefit the world in terms of protecting from COVID, but did cause enormous disruption and harm.
Okay. Some of those countries you cited, like Sweden, did see a massive rise in COVID cases relative to their peer countries in neighboring states. I'm just throwing out a counter argument there. So in some of these places, Florida, for example, saw surges in cases. Was that as a result of a lack of lockdowns or other issues?
I mean, it's not just Sweden that saw surges in cases, right? The rest of Europe also saw surges in cases. It's not just Florida that saw surges in cases. The rest of the country, the United States, saw surges in cases. So if you look throughout the epidemic, the age-adjusted mortality from COVID is no different in California than it is in Florida. Florida is older, so it has an older population, so you would expect it to have a higher death rate per capita but in fact, it doesn't have, once you adjust for that fact, it actually doesn't. We don't have a technology to stop the disease from spreading. The lockdowns fail because the world society is unequal. We said, remember that 70% of jobs can't be replaced with work from home. What that means is that when you lock down, it doesn't actually keep people apart from each other. What it does is it pushes a certain class of people who keep society going and say, okay, well, you don't get protected. You keep working. You keep delivering food. You keep repairing the electrical lines. You keep the water flowing. You do all of the work that we need in order to keep society flowing. And they're still exposed. The disease keeps spreading. Lockdowns were never going to stop the disease from spreading. And in fact, they haven't. Every society on earth has seen disease spreading despite sharp lockdowns. China is a good example of this. We just had a 2-month-long lockdown in Shanghai, and the disease came in a wave and it came down again. And you can tear society apart attempting to stop the disease from spreading, but this disease is not something where we have a technology to stop it from spreading.
We don't have the technology to stop this particular disease or any virus from spreading.
No, they are, like we talked about monkeypox earlier. Yeah. Monkeypox, actually, we have pretty good technologies to stop it from spreading. right? The kinds of tools that actually some of which were used for COVID and don't work on COVID actually do work on monkeypox. So identifying patients early, making sure that the people that they're in contact with, we identify them and then quarantine them for short periods of time. That works when you have a disease where it doesn't spread asymptomatically, where it doesn't have this aerosol spread that's really hard to stop. There are techniques in public health that are effective when you have a different disease that were applied here that weren't effective. This disease we do not have a technology to stop the spread of this disease. Those techniques that failed here may work in other diseases, but they certainly don't work here.
Okay. What are your thoughts on China's zero COVID policy then? They've shut down large cities across the country. Some economists have raised concerns about this lockdown and the lockdown's effects on the global supply chain. Doesn't help that there's also a war going on in Eastern Europe. So it's definitely exacerbating the logistical problems throughout the world. What's your take on China's zero COVID policy?
I think the Chinese zero COVID policy is insane. I think it's already a failure. Every country that's tried a zero COVID policy has abandoned it. The disease has animal reservoirs, right? Supposedly came from bats, dogs can get it, cats can get it. 80% of white-tailed deer had antibodies to it in the United States, and so you can't actually ever get rid of this disease. It's here to stay forever. Can you keep it out of your country via lockdown? China is a good example of this. They despite what looked to some people like a success, has turned out to be a catastrophic failure. The disease still spread despite enormous amounts of effort to keep China out. Can China continue if China chooses to keep going down the zero COVID path, it will essentially disconnect itself from the world, and COVID will still spread anyways. So it is already a failed policy, and if they continue down this path, it will wreak enormous economic and public health harm to the people of China.
Enormous health concerns and effects on the people of China. You mean these effects haven't taken place yet? They haven't been observed?
Some have. So for instance, like there's reports of people starving in Shanghai during the sharp lockdown. Food deliveries interrupted. People dying from heart attacks because they can't get to the hospital. They're locked at home. Mass civil rights violations, and the disease spread anyways. Right, the COVID spread anyways by monomaniacally focusing on a single disease, when in fact there are enormous, number of threats to human health that go beyond COVID. It's COVID necessarily means that you're going to slip on those other diseases. I mean, the cancer screen. I mean, they essentially closed down hospitals to anything other than COVID. Really, I mean, it's for that, and that will have consequences on health of population, right? Cancer screening is one example, I would think, but like as I said, if you look at what happened in Shanghai, I don't see how you look at it and call it anything other than a catastrophic failure. It will have consequences on the health of the population. It already has negative ones. All
right. Speaking of consequences, let's look to the future now. Assuming there will be another global pandemic, I don't know when, nobody knows when, but let's suppose something happens within our lifetimes. Now, I'm not talking about in 200 years, within our lifetimes. What can we do now to help us prepare for this coming pandemic? Again, we don't know the causes of this pandemic. We don't know the root virus or disease behind this pandemic. All we know is that there's probably another global outbreak on the same scale as COVID-19. What has COVID-19 taught us in terms of preparation? I know you disagree with government policy on lockdown, so I'm going to venture a guess and say no lockdowns in the future from you, but I want to hear your take.
I think there are a lot of lessons to learn. I think we have to look at what's happened during COVID squarely in the eye, and then make honest assessments of them in order to learn them. I think first we really do need to understand where this pandemic came from, right? So there's a line of thought that this virus was a lab leak as a result of a line of research called gain of function research. If that's true, then we ought to be regulating that kind of research much more closely. The gain of function research, the idea of it was to prepare us for the next pandemic.
Sorry to interrupt, but that's been labeled a conspiracy theory, has it not? I mean, what's your line of thinking there?
I mean, that was, again, by Francis Collins and Tony Fauci, but it wasn't a conspiracy theory. In fact, I think scientists are evenly divided. Some, or maybe even more on the lab leak side. I mean, I think we don't know with any certainty as yet, but it's received mainstream press attention, including in the New York Times. I don't think anyone calls it conspiracy theory anymore. What you can say is that it's a possibility that it was a lab leak. It might also have been a zoonotic spread from bats to humans. That's also possible. So it's not. We need to have an answer to that question to start to have a clear answer to what to do about the next pandemic. Because if it was a lab leak, then you have to do a very different set of policies to prevent the next pandemic than if it was zoonotic spread.
I thought the Biden administration had launched an investigation on the root causes of COVID. What did you follow up on that? What were the results of that investigation?
I don't think that we have an answer yet from any investigation that I've seen.
Okay. All right.
On the public health side as well, we need an honest investigation conducted by people who weren't in charge of the policy itself, right? So, how effective were the lockdowns? Who was at the table in deciding whether to do the lockdowns? I mean, my impression was that it was mainly people with virology, immunology, and some epidemiological experience. But that is not a sufficiently broad set of expertise when you have a policy with such wide societal effects and ramifications as a lockdown, right? So for instance, if economists had been at the table or sociologists had been at the table, they could have told them that a large fraction of the population wouldn't be able to abide by a lockdown for very long. Mm-hmm. And the disease would therefore spread anyways. I think expanding the set of experts at the table is a major lesson of the lockdown. The other thing is using the media to create fear in the population, which is essentially a tactic used by policymakers. I think it was deeply unethical. Mm-hmm. And it itself has led to enormous harm. We haven't talked so much about the mental health harms from these lockdown policies, but in July of 2020, 1 in 4 young adults had seriously considered suicide, according to a CDC study. The level of anxiety and depression in the United States is at unprecedented levels, at least in my experience. You have essentially a policy designed to create panic and fear in the population. A explicit policy adopted in order to induce compliance with the lockdown orders and other kinds of measures. That itself needs a thorough evaluation, and I frankly think we should never do that again. I mean, it was not right to manipulate the public in the way that it did in order to gain compliance. I think the right way for public health to behave is to treat the American public, the world public, as adults. To tell people what the risks are, tell people what reasonable science-based policies are to protect people against those risks. And then if shared sacrifice is needed, ask for the shared sacrifice on the basis of facts, not fear.
Okay, so Jay, we've talked about what governments did, in your opinion, what they did wrong. We've talked about the negative impact on media that they played throughout the pandemic. Let's talk about what governments should do going forward. Suppose another pandemic were to break out. Suppose we have another an outbreak on the scale of COVID-19. Hypothetically, let's say it happens today. We have an outbreak in a major metropolitan area. It's spreading like wildfire. We know very little about this relatively new virus or disease. We don't know where it came from. All we know is that a lot of people are getting sick, more sick than usual, and we have to do something about it today, right now. Suppose you were on the CDC in the US. What would you do? What's the first policy initiative you would want to implement?
I mean, I think the first thing is to get good information about how the virus actually spreads, the disease actually spreads as rapidly as you possibly can. And then make an honest assessment whether it's possible to suppress it to zero, right? So, and you want to do that very quickly, right? So with some diseases, it's possible with rapid intervention to get it to zero. Like Ebola was a good example of this, right? Where quarantining folks with Ebola actually did a very good job of reducing the spread of the disease, so it didn't spread to epidemic proportions or pandemic proportions like with COVID. On the other side is if it's clear that the virus or whatever the disease is has spread very rapidly and widely beyond our ken, we have to then decide how do we protect who's the most vulnerable and how do we protect them? That should always be the priority when you have a disease like COVID, where you really don't have a technology to stop the spread of it, but you might have a technology to protect vulnerable people. In the case of COVID, it was really clear from the earliest days of the pandemic that it was really older people and people with certain chronic conditions that were really vulnerable to this. And so what we should have done, and should do in the next pandemic, is move heaven and earth to protect whoever it turns out to be in the new whatever this hypothetical virus we're talking about is most vulnerable. If it's older people, you have a very different set of policies than if it's younger people. And at the table should be an enormous set of expertise far beyond just virologists and epidemiologists, because it's clear that they don't have sufficient wisdom to structure the changes society needed to address those kinds of threats.
Okay, well, thanks for your thoughts, Jay. We have to, unfortunately, end the conversation there. But before I let you go, tell us about some of the research you're doing currently and what we can gain from your work.
Yeah, sure. So I'm working with a couple of groups, the Brownstone Institute and the Academy of Science and Freedom. Our goal is to essentially do an assessment of the lockdown policies and to inform the evaluation of these policies by governments when they eventually do run honest inquiries into how effective these were, and then to think more carefully about what role should science play in policymaking? What guardrails can we put up in place so that the kinds of abuses we've seen of science and scientific power don't happen again, at least without good oversight. So those are the kinds of things I'm kind of currently working on.
Okay. Well, thank you again for your time today, and I look forward to speaking with you again.
Thank you.
Thank you for watching Kitco News. I'm David Lin. Don't forget to subscribe to our YouTube channel.